This episode is brought to you by Neurocrine Biosciences. Thank you, Neurocrine, for helping NADF continue to educate, bring about awareness, and save lives. Welcome to All Things Adrenal. Each episode, we'll hear stories from individuals living with adrenal disease, share updates on treatments, research, protocols, interview medical professionals, and explore all things adrenal together. I'm your host, Vanessa O'Rourke, NADF Community Engagement Manager and fellow adrenal warrior. It is my pleasure to introduce Jessica Cella, the 2026 California Senate District 40 Woman of the Year, recognized for her exceptional leadership, advocacy, and service to the community. Jessica serves as a family representative on the California Emergency Medical Services for Children Advisory Committee and has become a nationally recognized advocate for improving emergency care for patients with adrenal insufficiency. Drawing from her family's lived experience, Jessica has partnered with EMS agencies, physicians, patient organizations, and industry leaders to advance education, strengthen emergency protocols, and improve patient outcomes. Her collaborative work has helped influence EMS protocols, educate first responders, and bridge the gap between patients and healthcare professionals. Today, we are honored to have Jessica share her perspective on the patient journey and the critical role collaboration plays in improving emergency care. And with that, it's my pleasure to introduce Jessica.
Hi, Vanessa. How are you?
I am good. I am so excited that you're here. I've been eager to have you on the pod, and I just couldn't be more thrilled to dive into all that you do today.
Oh, I'm excited too. I really appreciate NADF putting this on and helping us get the word out to patients and caregivers and making sure everybody's got their stuff dialed in. That's the best thing we can do, right? Be prepared.
Well, and that's why we wanted to bring you in, because no one does it better than you. So we talked a little bit about it in your bio, but let's kind of rewind. And, could you share what inspired you to become involved in EMS advocacy?
Yeah, of course. So my son was diagnosed in 2019. He has primary adrenal insufficiency. He was diagnosed at 8 and he is now 16. So we're coming up on our 8-year, I call it anniversary here in January. Getting into this world was, I call it drinking from a fire hose that first year, just trying to figure out who's on first, what this disease is, how to keep your child alive. I'm sure a lot of people listening will be able to resonate with that. After the first year, I really decided I wanted to give back to the community in some way, and having somebody that understands what you're going through is so important. And I just didn't have anybody like that. And I wanted to make sure that I offered that to other people. So I obviously reached out and started mentoring new families for probably about 2 or 3 years. And the one thing that came up every single time I would talk to new families is their high concern for EMS and the lack of education. They're not able to do much. A lot of times they're only transport. They're not able to give patient-carried medications. They don't carry steroids. I'm talking broadly across the U.S. And at the time, obviously, I knew that this was the case in San Diego County where my son was diagnosed. We experienced the same thing. We were transport only back in 2019. And thankfully, our doctor, Dr. Brinkovic out of Rady Children's, did tell us that before we left the hospital and did warn us. And she basically said, if your son goes into crisis, we're going to give you an emergency medication. Basically, don't bother calling 911 because you're just going to waste time. That when they come, they're not going to be able to do anything. They don't have a steroid on the rig, and they're not able to inject our patient-carried medications. And honestly, I was so thankful for that advice that she gave us, and it was really powerful for us, scary and powerful all in the same sentence. And so that was a real eye-opener for me. And honestly, I think I've kept that feeling with me of just feeling like I was on a desert island, my husband and I, just looking around like, oh my gosh, like we are the answer, right? There is nobody else but us, and so you really have to dive into all of the information and what that means and being prepared. So that's kind of when I started my EMS journey, reaching out to different EMS, providers and trying to see what all this looks like. How do you make a protocol? Where does it start? Who do you talk to? How do you move the needle? Come to find out, EMS is actually very complex and no two EMS systems are alike, which makes it really hard as an advocate to move the needle. So it's been an interesting journey. It's definitely been an uphill battle. I would say 9 times out of 10, the door closes before it opens. But as you know, Vanessa, we've had a lot of success the last 1.5 to 2 years. We're very excited about the success and the momentum that we have. I think it's finally starting to gain some traction, and I'm really excited about the movement that we're making across the country.
You really are spearheading that movement. And I think I'd like to go back to, you said this, again, I'm a visual person. You mentioned this island, you were on, and you guys essentially, I don't know what it's like to be a parent, but as a patient, it did feel really isolating and really lonely in the beginning. And it felt like no one was there and you were on this island alone. And you have kind of been creating this like raft between, I'm thinking of a lifeboat, between an island and a medical EMS. So that's just really incredible that I think that's a good way to put it. And I think parents will really resonate with that. And what an incredible doctor to pinpoint and acknowledge like, hey, and this is, nothing against those EMS professionals in that area. There are restrictions in certain places and spaces, but that doctor let you know that. So that way you could keep your whole family safe during these situations.
It was very valuable information. And that has, like I said, prompted the work that I'm doing now. And I'm really trying to work with a lot of endocrinologists across the country to make sure that they know what their local protocols are so that they can share that with their patients. Just like my doctor shared it with us. And like I said, it was such valuable information because, if my son were to go into crisis and we basically were waiting on EMS to come, we're pretty quick in San Diego County, their run times, but even, 15, 20 minutes round trip, you and I both know that can be a really scary situation with no Solu-Cortef involved.
Every second counts. So having
That's
that foot out the door and boots on the ground essentially really, saves lives.
Absolutely, it does.
So when you first became involved with EMS, I know you said you realized there was a lot at play here, but when you got involved with the EMS education projects, what is the most surprising thing that you essentially learned?
There's a handful of things that I would point out. Obviously, I learned a lot, but the handful of things I would point out that I think is important for people to know is that EMS systems can vary significantly by state, by county, by region, and honestly, even agency. So what's hard is what happens at your house and who may be responding to your house might not be the same people that respond to your school or to the daycare or to your work, etc. And they do vary. Protocols can vary from county to county. So just because one county is able to inject your medication, don't assume that the next county does. And so that's really important for people to find out and to know what their county particularly looks like. And wherever you visit frequently, like I said, work, school, etc., make sure you know what those protocols are too. The other important thing is not every ambulance carries hydrocortisone or another steroid that can be used during an adrenal crisis. And I think sometimes our community, and God bless them, I was the same way until my doctor told us that you would assume that, if you get into a crisis, just call 911. They'll come. Surely they're going to have a steroid on their rigs and everything is going to be good. And unfortunately, you want to know that obviously before you call to find out that maybe they don't carry a steroid and perhaps they're not able to give patient-carried medications. And so you want to make sure in that case that you're training other people around you and hoping that they can act on your behalf when you're unable to in a crisis. So those would be a couple of things for sure that I would say were very surprising to me and I think are honestly going to be surprising to a lot of listeners here.
I think it's very obvious that there's lots of work to be done. There's work that is being done. But I like that you use the word assume. You really do assume with a lot of, and this is the case with many medical conditions, that you can have an incident, call 911 and be saved. But that's not necessarily the case in our situation, which is why you and myself and us at NADF are advocating and educating so much. It's really to bridge that gap in those spaces that don't have either the steroids on the ambulance or the protocols, necessary protocols. So it is really essential it's almost like doing your homework prior to an emergency happening, because we don't want to wait until we're in a crisis or someone that you love is in a crisis in order to find out what the protocol is and what happens. It's better to be prepared for those situations. So why is it important for patients to connect with their local EMS, for an emergency? We kind of just talked about this, but their local EMS agency. Why is that important? What should people be doing? And,
why is that essential?
Yeah, absolutely. So just like we talked about, you want to know what they have. And I always tell patients, regardless of what your county looks like or what your state looks like, you want to know what that is, right? Can I count on them to know that what an adrenal crisis looks like, how to treat it? Do they have they're not going to have the steroids on the rigs as far as our Solu-Cortef, most likely, but they might have another steroid. And so you really want to know what that is, right? What am I dealing with, so that if it's a situation like we had, right, in San Diego County in 2019, where they're unable to do anything, it's really better, if possible, to transport yourself. It could be quicker, and instead of waiting for an ambulance to come, et cetera. Obviously, it depends if you're able to drive and, some of the other circumstances, but it's good to know what you have in your area. So here's what I would say. I would say contact your local fire department, an EMS agency using the non-emergency line. You want to call and see if you can set up a time to come over and meet with, I always say, somebody. And, I think a lot of people think, the fire chief is the CEO. The fire chief is the person in charge. And that is 100% true. I will just caution everyone that they have bigger fish to fry. And I don't mean that in a bad way, but it's not their scope. So you really want to meet with somebody who's oversees EMS. And usually every area has someone. And sometimes that might be an EMS chief or an EMS captain. They all have different names. But essentially you want to just say, I want to meet with somebody who oversees EMS for my area. And then once you go in and schedule, a meeting, you want to make sure that you're bringing your emergency kit. And that's important because you want to educate them as much as they're educating you. I always call it a blind date. You don't want the blind date to be the first time you have an adrenal crisis. And when you have a blind date, sometimes it doesn't go that well, right? And so that's why you want to meet first, right? You want to get to know each other a little bit better, right? Like, what does your kit look like? What do your protocols look like? And so I think it's really important to make sure that you bring your kit, do some education, let them know what's in your kit, what they can expect if they were to run a call on you. Give them some information about adrenal insufficiency. The majority of these folks don't know much about adrenal insufficiency. I would also, on a side note, we really are pushing the words adrenal insufficiency. I know there's going to be some people on this call who might have, primary, central, secondary, CAH, etc. Adrenal insufficiency is the wording that my team and I have been using. It's the one that's most common. It's the one that's most used. So I really would caution people, on a side note, to use the word adrenal insufficiency when they're calling. That's what we're basing all of our education around is those wordings. So bring your kit in, make sure they know what's in your kit so they're not, scared to see something on the first call. And then you want to talk to them about what their protocols look like. A couple of questions that you want to ask are, do any of their ambulances or their fire trucks carry a steroid, such as hydrocortisone, dexamethasone, or methylprednisol? I will caution everybody on this call that we have only identified one state that carries Solu-Cortef statewide, and that is New Hampshire. Yay for New Hampshire. We haven't obviously, dug super deep into knowing every county across the United States. So if you have a county or an area that does carry Solu-Cortef, I would love to know about it. We can add that to our list. But as far as our research so far, that has been the only state that we have identified. The next question you want to ask is whether their EMTs or paramedics are allowed to administer patient-carried medications. I will warn you that there's not that many places across the U.S. currently that are able to give patient-carried medications. The majority of the time when you do find those places, it's going to be the paramedics. So make sure you do your homework on the difference between an EMT and a paramedic. An EMT you could kind of consider maybe like a nurse, whereas a paramedic you could consider a doctor, just to compare it in layman's terms for people. So a lot of times if you're calling 911, you want to make sure when you talk to dispatch that you let them know, let's say you're unable to give the injection or you want the neighbor to give the injection, etc. Or when they come, you want them to give it. You want to make sure that you're telling dispatch whether or not you have given your intramuscular injection, or if you're expecting when EMS or a fire truck arrives, if you're expecting them to give the Solu-Cortef. Because in that case, most of the time, they're going to need an ALS, ambulance or rig, to show up, which is advanced life support. And in layman's terms, again, I try to speak in layman's terms because not everybody knows all these EMS systems. ALS essentially means that they have at least one paramedic either on the fire truck and or on the ambulance. And sometimes you get lucky, you'll get both. So you'll have an ambulance with a paramedic and a fire truck that shows up with a paramedic. And in that event, either one of them, if their protocols allow, should be able to give give patient-carried medications. An example would be in San Diego County, we are allowed to give patient-carried medications, and it has to be a paramedic that's on scene that is able to do that. So that's always an important caveat to make sure that you know in your local area what that looks like. Let's see, you also want to bring a couple of your favorite handouts, I say. I know a lot of us carry binders. I know, Vanessa, you feel this, right? You've got binders worth of, pages and pages and pages of all the, different things that you have and different medications and yada, yada. I would really caution people to keep it very simple. These people work in the field and they're making decisions within 30 to 45 seconds. So in all honesty, they don't have 5-10 minutes to sit down and read an entire binder's worth when they show up to your house and your child is unconscious or your sister's unconscious, etc. So when you meet with these people, like I said, I would bring your favorite 2 or 3 very simple high level things. I always say you don't need them to understand adrenal insufficiency from A to Z. You need them to understand what to do in an emergency, right? And the nice thing is in an emergency for adrenal insufficiency, it's actually very straightforward. As Vanessa, you and I both know, managing this condition day to day is very complex. But here's the thing. We're not asking them to manage the condition. We're asking them to, give us our rescue medication and save these patients in an adrenal crisis. So I just want to make sure to remind people of that. I know I've been known to do the same thing. You go in, you want them to know everything, and you don't want to overwhelm them. And like I said, when you leave, you want them to know a handful of basic things: that you carry Cella, that you need this injection. What does that look like? And what are you able to do for me? And obviously, at the end of the day, the answer might be nothing. And that is valuable information for you to know as well. The last thing I'll say is, make sure that you are leaving that behind. So leave the instructions behind so that they can tell their coworkers. A lot of times they have 3 shifts. And so you want to make sure that shift A, B, and C is also able to get this information. So make sure you're leaving those special little 1, 2, 3 pagers behind so that they can hopefully educate their other crews as well.
I think you brought up so many, obviously incredible necessary points. But I have never thought about, and now I love this, the fact that we're not trying to teach them to manage the day to day. We're just trying to be saved in an emergency. And really it is, we just need an injection and we need to get from point A to point B to get the proper continued treatment or monitored at an emergency room. And that's a really incredible thing to break down, that it's like coming up with an elevator pitch. You don't want to tell them a 5-minute monologue about what's going on. You really need and I don't want to condense it down because it is a complex condition and situation, but 30 seconds to a minute, just something to get their attention, get the hook, and then make a landing point. So that way they understand, signs and symptoms, need this injection, got to go to the hospital.
Yes, absolutely. I know we can all, like I said, we love to bring our binders. We love to educate everybody from A to Z. And again, I would just make sure to caution people that really we just want them to know what to do in emergency and how to save us. So don't water it down with everything else. Just go in with those handful of things and kind of come out with what they can do for you. Give them some education, drop off some cookies, thank them for their time. I would say don't stay longer than 30, 45 minutes. Make sure you're very gracious. I'll be honest. Sometimes there's been some really big people in EMS that I've spoken to, and I've had to do a lot of cleanup duty. I know, obviously, I'm a parent myself. I know we can get a little bit sassy and aggravated at times when the system was not built for us, and I completely understand that. Obviously, that's why I'm trying to change it. But please understand that we have to respect our EMS, and we have to work with them. And going in, and I always say, burning the building down is not a good thing for us. And so we have to make sure that we're working with them and not against them. And just know that, they have their constraints as well. They have protocols and medical directors that they have to answer to. And so sometimes it's not necessarily as easy as, well, why wouldn't you want to save my life? Even though there's only 3 of us in this community, why would you not want to be prepared? It's a lot bigger than that. And so obviously I advocate for adrenal insufficiency. And honestly, I also advocate for EMS. These people have become family to me and very good friends of mine. I've gone to Capitol Hill and made sure that I'm advocating for them and their resources and what they need, because they need to be funded to make sure that they're able to do some things for us as well, because funding is a big piece of EMS and unfortunately is very underfunded. And that trickles down to people like us who, talking about a $20 steroid, they're not able to put a $20 steroid on every single rig because it's very expensive across the county. And actually you have to have 2 on every single rig. So you do the math on that. When they're working with shoestring budgets, it is a big deal for them. And they do have to be really careful about what they're spending money on and making sure that it's the best decision for the entire county, not just for a handful of patients. I know that's going to be hard for some people to hear, but it's really just part of the reality of what we're working with.
Well, and I think it's important to note that progress is happening, slow and steady, but things are changing and things are evolving. And in all honesty, our goal and purpose is to continue to raise awareness, to bring about education, and hopefully adjust these limitations here and there. But awareness is really key because it starts a conversation with, internally. Like I think about, and I don't know if I do this because I'm a overly sharing patient or because my experience at NADF as an advocate, but I'm the person at a concert when I see the EMT or the paramedics, I go over with my kit and I'm like, hi, do you guys know what adrenal insufficiency is? Just because I'm curious. And I would say 90% of the time they say no, and they're not really always interested in what I'm going to say, but I'm always just curious. Do you know this disease? Have you ever given this injection? It is a mixed bag. I've gotten mixed reactions, but who knows? That one question, that one conversation could go back to the top of the line or whomever, and it might start another conversation, and it could save one life potentially. Or even, someone might be like, oh, I remember someone mentioned that a month ago, and I think there was an injection. Whatever it is, whatever little trickle we can do. I know you're focused on the EMS and the EMT and all those in your local area. My brain is just anywhere and everywhere I am. I'm just going to talk about it and I'm going to tell people, and it might be annoying, but it also might save somebody's life. So it's worth it.
You're absolutely right, Vanessa. And I think it should be something that everybody should strive for. A lot of times, like my son broke his hand. So we're seeing the orthopedic surgeon, and it's like, they need to know about adrenal insufficiency as well. So I take the time to try to educate everybody within my sphere. And honestly, like you said, people who may or may not be coming across adrenal insufficiency. A lot of times EMS will tell us that they've never had a call. They've never ran an adrenal insufficiency call. And the hard part for me is once, they hear me talk, right? When I do my education, at the end of that hour education, I can't tell you how many of them came up to me afterwards and said, oh my gosh, Jessica, there were so many patients over the years that I am certain had this condition. I just didn't know what I was looking for. And the other piece that can be tough too is adrenal insufficiency steroid dependent is wording that our community uses. Training 700 paramedics personally, I asked every single class, what does that mean to you? And unfortunately, that's not something that means anything to them. It doesn't, trigger them to give a steroid. It doesn't trigger them to know that this is a deadly condition. And so that's a little bit of the breakdown that we're finding as well, is that, as patients, we have to speak their language if we're asking them to act on our behalf. So that's another thing that we're looking into and trying to work on, which kind of segues actually into the emergency kits. So emergency kits, like you and I both know, are so important. Want to make sure that everybody has one. And then more importantly, they want to make sure they know what needs to go in it. There's a handful of things that you want to keep in this kit, but there's also some certain things that you want to make sure to have on in this kit, so to speak. So I'm showing it to Vanessa on this video, knowing that we're only on a podcast. You can only hear me, but these new emergency kits that just came out, it's by myguardpod.com. You can find them there. I know Vanessa and I both have them. I think they've been amazing. They've gotten really good results. I actually worked personally with Elaine, who's the owner. We went through and redesigned every square ounce of this kit to make sure that it was EMS friendly. And when I say EMS friendly, I'm going to tell you what that means. So on the front of this kit, it says adrenal crisis treat in place. Treat in place is something that our adrenal insufficiency community probably has not heard, may not necessarily know what that means, but it's exactly what it says. Instead of transporting this patient, you want to stay on scene and you want to treat this patient where they are. In the EMS world, they call it TIP, T-I-P. It's a very big word that's used very often in the EMS community. It's something they're very familiar with. And so what we wanted to do was use wording that would trigger the EMS community to understand what we needed from them. So essentially, if they're able to, we want them to treat us in place, right? Because what's happening is sometimes when these people they don't have the education, there's nothing that they're able to do. They load these patients up and just transport them. And unfortunately, Vanessa, you and I both know that has turned deadly for several people in our community. And that's really hard to hear. And so The treat in place on the front of this kit is really to speak to EMS, like I said, to make sure if they're able to, and hopefully they can, they're able to either inject this medication or perhaps they have Solumedrol or dexamethasone on their rigs that can be used instead of our Solucortef if they're unable to give patient-carried medications. The next thing I want to make sure people know too is inside this kit or your kit, whichever, you want to make sure that you're keeping your Solucortef in the original box. I'm going to say that as slowly as I can because I cannot tell you how important it is. Make sure when you're going to the pharmacy and you're picking up your Solucortef injections, if they come without the original box, you need to make sure that you're telling them beforehand, if possible, that you need them to order these within their box. Some of these pharmacies, CVS included, might say, we don't order them that way. We order them in bulk. It's a lot cheaper for them to get them in one big box, and then they just pull the individual vials out. Now, why is that scary for our community? People will ask. Why it's scary for our community is because if you have a paramedic, most likely, who is on scene, who potentially could bend the rules for you if you're in an area where they're unable to inject patient-carried medications and they do not carry a steroid on the rig, if they understand, obviously, the importance of giving this medication and they're willing to, like I said, bend the rules, they want to make sure they know this is the patient in front of me, right? This is, Cella, or this is so-and-so in front of me. And they want to verify that with a sticker on the front of the original box. So make sure you have it in the original box from the Solucortef, and on the front of the box needs to be your RX sticker. The RX sticker is going to tell these paramedics the name of the patient. It's going to tell you how much medication they need, the name of the medication, their date of birth, and some very important information that they have to check off on their side in order to give this medication. So I always say, even if you're in an area where they're unable to give patient-carried medications, you always want to keep it in the box and be ready with the sticker on the front, because there's a possibility that somebody might take a chance and give it to you. Now, I'll be honest in saying they can lose their license. It's important for us as patients to understand that they're honestly putting their job on the line when they're doing that. So I know a lot of people expect EMS to do that, but I think it's a lot bigger than that. And I want our patients to understand that it is a big risk for them. And obviously all of us hope that they take that risk, but it really is a big risk, and they're asking them to put their job on the line to do this. And so not everyone's going to do that. You've got new paramedics out there, people who've only been on the job for maybe a couple of years or a couple months, etc., and who don't feel comfortable doing that. So you just want to be prepared that if you get yourself in a situation that you have it in the box with the RX label on the front. Secondly, I always tell people, make sure you're carrying a double set of needles. Some people use one needle, some people use two needles. It's neither here nor there. It's personal preference. But if you carry two sets of needles, whether that be 2 or 4, it's very important, because if you're out in the field and perhaps your neighbor comes over to give you this injection, and for some reason this is the first injection they've ever given, and maybe they're bending the needle with inside the Solucortef, or maybe the needle breaks off, or maybe a needle, is malfunctioning, etc. So you always want to make sure you're carrying extra needles. That's one thing I always tell people as well. You want to make sure the front of it is also labeled very well. I've seen a lot of people carrying around eyeglass kits to keep it small so they can put it in their purse, etc. The only problem with that is that sometimes it's not labeled very, 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 very clearly. I keep saying that because if you think about it, if EMS walks into your house, you want to make sure that it's like in flashing lights. I tell people, get like a little hook, one of those little 3M hooks, and put it on your wall. And have your emergency kit hanging from said hook on the wall, right? So that when they walk into your house, if you're by yourself, Vanessa, if you're by yourself and your significant other isn't there and you're found unconscious, you have a kit that is labeled, with the adrenal insufficiency on the front. Potentially, maybe you say treat in place, which is our new wording, etc. So if you're making your own kit at home, which is totally fine, you just want to make sure that it's clearly labeled. And again, if you want to buy one of these great kits that have it all in one, you're welcome to do that too. But I know some people have constraints from a resource standpoint. I just want to make sure that everybody understands that whether you have $10 to spend or $100 to spend, you can do it either way. There's just a handful of things that you have to do it. You have to do it right so that when EMS comes, they know what you need, you're showing them what you need, and you have the instructions on the inside so that if your neighbor comes or EMS comes, etc., that they're able to pull out those instructions, follow those instructions, and give them this medication. I know I've been long-winded on this one, but I'm going to tell you one more thing. A lot of people don't understand that EMS has not seen a Solu-Cortef vial 99% of them. And if you think about it, if there's only one state that we've identified so far, New Hampshire, that actually carries Solu-Cortef on their rigs, how can we expect all of these, EMTs and paramedics across the country to have seen a Solu-Cortef vial before? So I always tell people when you go visit the firehouse, make sure, I forgot to mention this, when you go to the firehouse, you're showing them your kit, I always bring an extra, like a expired vial, and make sure you're actually letting them reconstitute it, getting their hands on it so that they can see how to do it so that they feel comfortable. Because that's the other piece of it is essentially like put yourself in their shoes. You're asking them to give a medication they've most likely never seen. You're asking them to reconstitute a medication that they've never reconstituted before. Now, granted, sometimes they have, some glucagon and some other medications on their rigs that that look similar to that. So it's not to say that they don't know how to do it, but obviously all of us, when you're familiar with something, you're more apt to act, right? So whenever you're doing your education at the firehouse or wherever you are, right, in the middle of a doctor's office, like Vanessa and I were talking about, you want to make sure that you're letting them put their hands on that vial and making sure that they feel comfortable, using and looking at the Solu-Cortef vial. What does it look like, right? What is it going to feel like when it's reconstituted, et cetera? I think that's a really big piece of this pie that we're really trying to kind of check off. So hopefully that makes a lot of sense for people at home, making sure that you have your emergency kits done the right way. I always say give it to a neighbor or give it to somebody that doesn't know much about your condition and say, if you were to come across this kit, what would you do? And let them open it, right? Let them look at it. Let them pull everything out and say, oh my gosh, I would have no idea what to do with this, right? And then you're like, okay, I think I need some more instructions in here. I think I need it labeled better, or I'm sure that person can help you, give you more information about what you can do so that when somebody picks up this kit on the street who doesn't know you, you might be asking them to help you, you want to make sure that it's very easy for them to follow instructions on how to give that Solu-Cortef injection.
I absolutely love the new, I have all three of those MyGuard Cordopods, but I like the biggest one because, me, I'm like to be over-prepared. I want everything. And I cannot overemphasize, I think I've only had it for like a month, how much more I love it than my Canvas one because my syringes all got smashed and mushed up or broke apart, the kind that were supposed to be built together. And now they're in a secure, safe space. And I'm so glad that you said to have multiple because every year before I get my new prescription, I always practice with my expired ones. And I would say, in the 10 years I've had this disease, 3 times have my needles not worked when I'm practicing. And those are my needles in my kit. So it is so imperative to have extra because there is, there's user error, manufacturer error, and there's life. Like things happen. Or what if you drop the needle and you're on a boat and it falls in the water? Like, what are you going to do? So having as much as possible is essential. And, all this training and all this prep and all the work that you've been advocating and doing and spearheading is like the final measure of things. This is why NADF says to inject yourself before you call 911 because we don't know that they're going to be able to give that injection. We don't know that they're going to be able to do any of that. And it's so imperative to do every single thing. And hopefully you never have to do this. And in a perfect world, everyone's managing their adrenal diseases well, and the world's not causing other challenges. But, that's not reality. There's things that are going to happen. And I'm really glad you brought up the boxes because I literally didn't learn this until I learned it from you this year. So I don't have boxes in mine, and that's because I have my prescriptions, but when they expire, my next ones, I absolutely will be holding those boxes because we don't want a piece of cardboard to be the reason why we're not getting potentially life-saving medicine.
Yeah, I agree. And I tell people too, try to give your pharmacy a heads up when you go in to reorder them. Go in person. My other advice, we've been at this almost 8 years. I always go to the mom and pop pharmacies. And the reason why is because you get to know your pharmacy. You get to know your pharmacist, right? Like I literally have, my pharmacist's name is Raj. He's my guy. He's part of my medical team, and he's a big piece of my medical team. I can text Raj anytime and say, hey, Raj, I need 5 more Solu-Cortef injections and I need it by next week, because I'm doing X, Y, and Z or whatever. And he's always responsive. He's great. A lot of times he'll have somebody deliver it to my house. This is the kind of, things that you can get when you work with smaller pharmacies. And I know sometimes people get hung up on the CVS, Walgreens stuff, but, I pay more if I have to to. I always pay more to go to the mom and pop shops. I always meet with them we've moved a couple different times. I always go in and meet with them. Again, same thing with the firehouse. You want to leave some things behind, make sure they understand what this condition is. It's important that, sometimes people have little nuances, right? Where maybe they can only have a certain brand of hydrocortisone, or they can only have a certain brand of fludrocortisone. And those things matter to a lot of our patients. But here's the thing. If you're not communicating with your pharmacist directly and letting them know that those things are important to you and important to your care, there's no way for them to know. So make sure that you're communicating with your pharmacist in advance. And if you do go in and you do find that these vials are not in their boxes, you have every right to refuse those vials, right? And you just need to say to them, unfortunately, I can't take these vials because I need them in their original boxes. And if they say that, for instance, CVS might tell you to go kick rocks, right? And that's when you say, great, I'm going to go find the pharmacy down the street, right? Who is going to make sure they're going the extra mile to find these Solu-Cortef vials in their boxes and make sure that we have the patient, stickers on the front. One time, my sticker is kind of rubbed off. I don't know if this has happened to you, Vanessa, but sometimes in the kits, right, you're kind of pushing them in and out. And obviously these Solu-Cortef vials are good for about 2 years. And so sometimes, it rubs off on the patient sticker on the front. And so I just went into Raj and said, hey, Raj, can you print me out some new stickers? He's like, yeah, absolutely. So I just put the new stickers on the boxes. They were, my quote unquote old Solu-Cortef, vials that were still good, but on the front, you couldn't read the sticker anymore, which I'm trying to educate people is also a very important piece of the pie here. So don't be afraid to go in. These people work for us, right? And you can hire and fire whoever you want. And, the last thing too is make sure you're not overpaying for these vials. You can cash pay 99% of the time, and it's going to be cheaper than using your insurance. And I know that sounds absolutely crazy, and I've tried to work with Pfizer unsuccessfully, unfortunately, but I try to educate people that a lot of times when you go in, just say, how much is the cash pay? I always tell people do not pay any more than $25 per vial. You can absolutely get them for cash pay for $25 or less. I just saw too on Amazon, they have a new pharmacy, and Amazon Pharmacy actually has them for, I believe it was $19 and some change. I reached out to one of the families who said that they had used the pharmacy, and I said, did it come in the original box, right? Because of course, this is what I'm trying to educate people on. And she responded and said, yes, that it did. Now, it didn't have the RX label on the front of the box from the picture that she sent me. So I can't necessarily speak to any of that. Maybe you can put in the chat, to the Amazon pharmacist that you want to make sure that you have these things. I can't speak to that, but I'm just saying people who have resource constraints, right? There are ways to get these vials that are, more economically sound. Some people are paying $60 for these vials and using their insurance when they can cash pay and get it, somewhere between $20 and $25. So I want to make sure people know that. Because again, resources, everybody's choosing sometimes between whether they're getting 2 vials or whether they're buying a new emergency kit with 1 vial, right? And so all of this stuff matters to some people out there. And so I just want to make sure that resources, when they're tight, that you're doing your best to try to get the most bang for your buck, right?
I think this is all just goes back to how important it is to set up your community, be involved with your local area so that way you can be supported and safe in your home, in your local area. But what about patients? How do they prepare for an emergency at school or while traveling? What other steps can they do?
Yeah, and I think that's a great point, Vanessa, that I try to bring up to people as well. A lot of people kind of hone in on their home, right? And what are they going to do when they come to my house? What are they able to do when they come to my house? You also want to know, what are they able to do at your workplace? Like someone like you, Vanessa, like obviously an adult who might be out in the world working, or for instance, my son at his high school. What are they able to do at his high school? It may not be the same thing that they're able to do at your house. So make sure that you're inquiring about what that looks like. Talking about schools specifically, I always bring a copy of the local protocol to the schools to make sure that they are educated as well. Another thing, as far as, advocating for EMS, a lot of people on our side, in our community, are floored because a lot of times EMS doesn't know their protocols. And I think on the patient side, we think that's crazy. Well, when you start diving into it, some of these larger organizations, they have up to 300 protocols. And so you can't expect all these, EMTs and paramedics to memorize all 300 of their protocols. And honestly, this is a protocol that's not often used. You and I both know part of it is because our community doesn't trust trust EMS fully. And so I think a lot of times we're not calling them. I think that's a part of why they're not seeing us, right? But working on that and trying to gain the trust on both sides, I think that's an important piece, is educating the people, like I said, at your school, at your work, at your daycare. Here's the local, protocol if you have one. Or honestly, like I keep saying, it's important to tell them that they're on an island, right? You don't have help. If, little Johnny is unconscious at your daycare and, they're calling 911 and hoping that they're going to come and do something, knowing darn well that they can't, right? That's important information that can also save lives as well. And like I said, make sure that you're giving them the protocol so they have a copy of it, so that if they were to show up, I always say, if they were to show up at my son's school, my nurse knows S137 is going to be followed. She knows the protocol. She has a copy of it so that she can show them. And so this is also something that I recommend putting in your kit. You can shrink it down when you're printing it. Instead of printing it on a huge 8.5 by 11 page, you can shrink it down so that you can cut it out and put it in your kit, so that if you forget, what the name of your protocol is, or, what number it is, whatever, you can pull it out of the kit, when your brain stops working, when your child's unconscious on the floor. I know that's happened to me. You can just pull it out of the kit and show it to them, and they're like, oh yeah, they can verify that on their end, or they can call medical control and say, hey, I'm here at this house. I have everything in place. I can see the box. I can verify that this is the child. I know how much medication to give him. It says on the front, da, 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 da. As long as they can check all of their boxes, hopefully medical control, will support that as well. Not always, but again, it comes back to the education piece. The more education that we can do, the more education we can do for school nurses. My team and I have trained over 400 school nurses just in the last couple of months, which is amazing. We have found that school nurses love the education. Not a single place has turned us down yet when I reach out and say, hey, the pediatric endocrinologist and I want to come on and give some more information about adrenal insufficiency. They always say yes. So always try to reach out to people that are, if you have a child in school, maybe perhaps not only just training your local, I say nurse loosely, a lot of times it's a tech, but, training that warm body on campus. Maybe you can train the district as well and get everybody from the district involved. You can also ask how many people within that school district have adrenal insufficiency, which I did in my local school. And if anyone's curious, there's 15 patients amongst 30,000 kids within our school district, which is a pretty high number. And this is another fun fact. There's 4 on my son's campus, which is really also pretty crazy. So, but sometimes that can help you when you're talking to the local fire station or you're talking to the local nurse, right? This isn't just one patient. This isn't just like, once in a million chance that this kid's going to go down. I know my station, it's number 42. And every time I drive by, I'm always like, those are my people. I'm going to, hopefully that when I need them, they're going to show up. They've been educated. They know my name. They know my son's name. And they know that there's 4 patients over there that, they're going to get that first call. Station 42 is going to be the first call that's going to be, getting it from my son's high school. And they know with 4 patients over there that, could be a life or death situation. That's going to motivate them to make sure that they're ready. So I think that also makes a difference. If you can, the more that you say, this is rare, this never happens, it doesn't actually help our cause. So just keep that in mind as you're talking to people. The more that you can say there's, X amount of people at this daycare, X amount of people, in the school district or whatever, it makes it a little bit more relevant to them as well.
Well, and I think this also just goes to the more homework you do ahead of time, the more planning, the more prepping that you do, that can change things in the future. And isn't it better to be overly prepared and never need it than to not at all? It's best to be
Absolutely.
Prepared in any situation. So you have become this incredible front runner as a volunteer and advocate. How can somebody else do that? Someone listening might go, oh, my loved one, or I'm an individual, or my kid, I want to get involved. Where do I start?
Yeah. And to be honest, it's been really great. I've actually been getting a lot of messages, from families and from other advocates out there who, want to move the needle in their area. And they're like, Jess, tell me what I need to do. How does this work? Where do I start? And I think really, to be honest, it's just starting. When I started out, like I said, there wasn't anything official. Once I got my feet underneath me after that first year, I just started reaching out to families and saying, hey, you're not alone. And honestly, I think as a caregiver, that's all you want to feel, is that you're not alone, right? And so I think starting locally is a great place. And maybe that means maybe you're I don't want to say hot button, but, maybe your gap that you want to help fill is EMS. Obviously that was mine, right? But it doesn't have to be everybody's. Maybe it's you want to educate all the nurses, or you want to educate the community, or, so just, I would start small. Just take something small on that you think that you can do within your capacity, and it'll grow from there. I'm always learning. I'm always growing. I feel like, I've dedicated my husband will tell you, most of my life, the last 4 years, day in and day out, to, EMS protocols. How does it work? The ecosystem, all of that. And honestly, there's still a lot I have no idea about, because the system is so complicated and so complex. So I think instead of saying, oh my gosh, this is too complicated, I can't figure this out, I don't even know where to start, you just have to find a place to start, and just start small. Like I said, even just starting with your local firehouse. And maybe your local firehouse says, oh my gosh, this is amazing information. I don't think our district knows anything about this, right? Let's get you in front of X, Y, and Z. And maybe that can grow from there. Cold calling is scary, but it's something that I have to do often in the work that I do. And I always say, 9 times out of 10, the door is going to close on you, right? But if you get that one chance, that one opportunity, that's all it takes, and I'll never forget, Lindsay Smith out of San Diego County, she believed in me. She believed in what I was doing. And I got on a Zoom call with her and told her about the education and, the team of people, the pediatric endocrinologists that I had behind me. And I basically was just saying, like, just give us a chance to show you what we can do with our education. And this is really going to change lives and save lives, and I always give Lindsay credit, because she really did believe in the mission, and she, was really the first person in a very large system. San Diego County covers over 3 million people. To train 1,100 of their paramedics within San Diego County is the biggest training that I'm aware of to date across the country. But again, that never would have happened if I didn't pick up the phone and try to reach out and try to make something happen. So I would just say, you have to have thick skin, put yourself out there, be prepared, reach out to other people who have been doing it, perhaps longer than you. And just, like I said, just finding a small place to start, right? Like, yes, I've been to Capitol Hill, yes, maybe I've been, volunteer of the year, and, what is this? California Woman of the Year. I'm looking at my plaque next to my desk. California Woman of the Year. Are those all amazing things? Absolutely. But honestly, like, helping a family that reaches out to me that says, I don't know what to do. I don't know where to start. I was newly diagnosed. I'm terrified. What do I do? Helping those patients is what really fills my bucket, to be honest. The EMS stuff is hard work, and you get a lot of no's. But it's really impactful work that I think over time is really going to save lives. And like I said, I hope is going to continue across the country, really. And some places are harder to move than others. Once you kind of get into the EMS world, you'll see that, some of the small areas are a little bit easier to move, and some of the big districts are really, really tough. And you've got to bring in some big guns. Like I said, I think we almost got to know. And when I brought in all of the local pediatric endocrinologists at my local children's hospital and got them on an email and, kind of brought in some big guns, we made sure that things happen. So don't be afraid to reach out, to your local endocrinologist and trying to get them involved, trying to get, their institution involved. Because sometimes those are the big voices that you need to support you, more so than just, you're a small fish in a big pond, right? You're 1 in 3 million people trying to move this. So make sure you're building a network of people that can help you, and don't feel alone, and surround yourself with great people that want to see the work being done as well, because they're out there. They're absolutely out there. What I've seen over the last 2 years, I've been doing this advocacy work for about 6, but what I've seen over the last 2 years has really been a huge shift in our community and the people surrounding our community and supporting us, people that are not afflicted by this condition, but that are showing up for us every day. I mean, I could name you 25 people off the top of my head within the EMS community who have absolutely shown up for not only, me personally, but for our community, and behind the scenes are doing a lot of work to make sure that, we're able to make this happen across the country. So I just want people to feel that hope, to feel that there is progress being made, that there are people out there who care. Of course, yeah, that's not everybody. Like I said, you're going to get 9 times out of 10, they might slam a door in your face, but you know what? You just need to find that one that does care and see how far you can go with that one person who believes in you and your mission and what you're trying to do.
It really goes back to one pebble can change the ripples for everything. And you are that one pebble. And, you've encouraged so many other people to be that pebble and continue that change and continue that growth. So it's tiny steps that turn into giant progress. And I just, as an individual and as someone from NADF, I can never thank you for the work that you do appropriately, because not only do you save lives, you will save lives and change lives, because the protocol is inching forward because of you. Okay, I want to absolutely honor your time and energy because you've shared so much and you always do so much, but is there anything else that you'd like to share before we end our time together?
I just want to reiterate the handful of things that we talked about today. Make sure you have an emergency kit, number one. Make sure it's labeled. Make sure the things that are in the kit are, done well in the box with the patient label on the front, multiple needles done. Make sure you have it labeled. And like I said, make sure you have one hanging on your wall. I'm kind of a kit crazy lady. I have 10 kits, but okay, so maybe you have 3 or 4. Make sure you have one always hanging on the wall, ready to go or ready to be advertised if you need it. Reaching out to your local fire station is absolutely a must. I know it can be overwhelming for some people to do that. And I surely felt overwhelmed at the beginning too. But again, you just have to start. And, sometimes making an appointment makes things a little bit easier because a lot of times they don't love the cold, knocking on their door when they're in the middle of dinner or whatever. I'll be honest, that's not the best way. But if you can't get a hold of anybody, that's not the worst case. But always try to get an appointment or at least let them know that you're coming, best case you can, and educate everybody around you. Educate them on how to give this injection. If you have expired vials, let them practice. I think that's a huge piece in our community is people have never seen this Cellucortet vial. Your neighbor hasn't seen it. The people at your work haven't seen it. The nurse at the school definitely hasn't seen it. So make sure you're using those vials and the expired ones, keeping those on hand and training people around you. And obviously, number one, if you're able to inject before transportation, that is always the best thing, right? I know we're talking about EMS and trying to count on them and trying to figure out what they can do. But honestly, at the end of the day, I say even in the best circumstances, who have the best protocols, who have trained everybody across their district, etc., there's still things that can go wrong. In all honesty, nobody's going to be 100%. So obviously, training yourself, training the people around you, and injecting before you go to the hospital is always the best thing to do first. And try to get involved whatever capacity you have. Maybe it's only an hour a week. Maybe it's 10 hours a week. Whatever it is, try to give back to the community because there's not a lot of us, and I would love to see more people getting involved, not only necessarily in EMS, but just education and trying to educate our own community is a huge piece too. So there's lots of work to be done. I would love to see more people getting involved. People can reach out to me. I'm on LinkedIn. I'm also on Facebook. There's lots of ways where you can help our community that may not necessarily be 60 hours a week and doing this all day, every day. So just take on what you can. And just be prepared. That's my last thing I'll say is be prepared. Be prepared before an adrenal crisis strikes. That's for sure.
I think that's the most important thing to take away. You've given us so much information and then so much homework and so much good, juicy stuff. But really, at the end of the day, be prepared prior to needing to be prepared.
That's absolutely right. Yep. Don't let that blind date creep up on you, right? You want to make sure you're meeting people, before you need to go on that official date.
I love that. Well, thank you so much for being here, for sharing, for advocating, and for every single thing that you've ever done, will do. Again, you've done everything, you're doing everything, and you are just paving the way in new ways that, honestly, I'm so grateful because I don't have the bandwidth to do the capacity that you're doing. We all have different skills, and like you invited people to join in and do things. Just do what you're good at. Do what you can do for the community for awareness, because everyone has different skills, different gifts, and yours are very clearly advocating and educating and making change, because that's clearly what you've been called to do and are doing.
Yeah, absolutely. Just gotta start, right? Just give back in some small way to the community, and all of us together, we can move mountains. That's what I like to say. So,
well, thank you so much for all that you do. It was a pleasure having you, and I look forward to all the progress you keep making.
Thank you, Vanessa. I really appreciate you having me on, and to everybody who's listened up until this point, thank you. And reach out if I can help in any way, and just be prepared, everybody.
Thanks for being here, Adrenal Warriors. I'm your host, Vanessa O'Rourke, sending you all the spoons, and I hope you have a wonderful day. Thanks for joining in on another episode of All Things Adrenal. This episode is edited and produced by Magdalene Zinke. For more information on the National Adrenal Diseases Foundation, please visit nadf.us. If you're listening on Spotify or Apple Podcasts, please leave us a rating and review to help others find out about all things adrenal. If you have a story you want to share or a question you'd like answered, reach out to NADF support at nadf.us.